Good morning, everybody. My name is Dr. Raj Gupta. Just to introduce myself to people who don't know me, I did my neurology residency from NYU Medical Center, and then I went for fellowship in clinical neurophysiology at University of Michigan, Ann Arbor. I am in the Bay Area since 2006, and I work predominantly at regional, but I also have privileges at Good Samaritan Hospital, O'Connor Hospital, as well as El Camino Hospital. And purpose of this video is to educate public about the implications of closure of specialty programs at Regional Medical Center. And let me share my screen. So just to give an idea, HCA stands for Hospital Corporation of America. This was founded in 1968. They have 185 hospitals within 20 states in USA and 1 hospital in UK. For-profit chain, it's a parent company of both Regional Medical Center and Good Samaritan Hospital. Net income for 2023 was $5.2 billion. Total assets are $56.2 billion. They did provide charity care, uninsured discount, and other uncompensated care at an estimated cost of $3.7 billion throughout the United States. Now, RMC stands for East Side, 264 bed capacity. We can say this is a HCA hospital, East Side, San Jose. And Good Samaritan Hospital, West Side, HCA Hospital, West Side. Now, RMC announced on February 13, they're going to close these programs. And emergency medical services public hearing occurred on March 27. And I really want to thank County of Santa Clara Board of Supervisors. I think this one video is worth watching by everybody in the Bay Area, how they really got the bottom of what is a problem and what impact it will have. This occurred on April 16, 2024. There was a unanimous recommendation to the state not to approve RMC request. As per RMC, all the changes will be implemented on August 12. So we have about, more than 2 months. Now, there was an impact study done by Santa Clara County Emergency Medical Services Agency released in April 2024. I would strongly suggest everybody who is in public health or care about public health to read this study. This really is eye-opener, very, very powerful. So just to tell a little bit about location of Regional Medical Center, you see it's a beautiful building on the east side of the San Jose. Now, population of San Jose is 1 million. It's the 10th most populous city in the United States. Only single community hospital in the East San Jose, and it's very densely populated. So we cover almost 1/3 of the population of Santa Clara County. If you take 1.8 million, about 600,000 lives are covered by Regional Medical Center. Remaining 8 hospitals, mostly they are located on the west side of the town, and they cover about 2/3 of the population, about 1.2 million. Now, more surprising is RMC has a bed capacity of 264 only. While remaining 8 hospitals, if you combine them, they are approximately 3,000 beds. So this big discrepancy between the community needs and assets we have in the community. RMC is the only hospital in 5-mile radius out of 9 hospitals in the county. And the populations, they have high rates of vascular disease, including hypertension, diabetes, coronary artery disease, stroke, obesity, and also a lot of trauma. Now, this slide is also very powerful, and I think worth spending 1 minute on it. Now, Santa Clara County overall, if you look at the census, Hispanics are 24.7, and whites are 28.3, and Asians are 41.4. But look at the east side. Hispanic or Latino, at least 50% or more. Whites are only 4.6%, Asians are 41%. And majority of the Asians, they are represented by Chinese, Vietnamese, Indian, Filipinos, and many others. So it's a very, very diverse population. Now, let's talk about what will be the impact of stopping a trauma program at RMC. Now, at present, RMC has a highly acclaimed trauma team, experience of about 37 years. And you have in-house trauma surgeon, you have nurses, orthopedic surgeon, neurosurgeon, radiologist, tech, Angio Suite, plastic surgeon, ENT surgeon, cardiothoracic surgeon. Now, we have almost like 2450 trauma patients annually. This is almost like 1/4 of all reported trauma cases in the county. Now, changes in trauma service at RMC will have a big impact on Santa Clara Valley Medical Center, and I will tell you in a minute how. So if you look here, this graph is very powerful. It tells us three trauma centers in the county. This is the regional, this is the Santa Clara Valley Medical Center, and this is Stanford. So you can imagine all this area is being fed at regional, right? And even Alameda County, patients come here. Now to go from here to here in ideal situation will take 15 to 23 minutes, but from here to here may take an hour. So it is going to be quite challenging to navigate this. So what will happen when doors closes for trauma center? On August 12, there'll be no in-house trauma surgeon, neurosurgeon, OR tech, Angio Suite tech, plastic surgeon, ENT surgeon, or cardiothoracic surgeons. No, RMC has both walk-in and private vehicles and EMS bring patients. Even though EMS will bring patient to Valley Medical Center, but walks-in will come. And the only help they will have is ED doc, which are present are mostly locums. So to transfer from ED to Santa Clara Valley Medical Center will take at least an hour or so. Now, the golden hour is compromised. So in case of severe trauma, every second counts, and longer travel times can significantly impact patient outcome. A study was done which have showed that closure of a trauma center increases death of critically patient by 29% in first 2 years after closure. Now, if we do daily impact of closure, so we have about 6.7 patients per day. So we can anticipate per day up to 7 patients that may have increased disability and death. We need to remember this number. Now, other thing very, very important is not only the trauma helps with the trauma patient, it is a community asset for disaster management in east side of the San Jose. So 1/3 of the population is served. So when you will close it, those population will have no coverage for earthquake, a vehicle accident involving public transportation, active shooter incidents in highly densely populated area. So let's talk about second service they are going to cut down. Regional is another comprehensive stroke center. We have 3 comprehensive stroke center in the county, regional, Good Samaritan, and Stanford. Now, RMC is among the top 5% in the United States, and it is the only comprehensive stroke center on the northeast, east, and southeast side of the county. It received the highest concentration of stroke patients among all hospitals in the county, with 20% of all stroke cases presenting there. We have a highly trained stroke team for 20 years. We have telestroke neurologist, neurointerventional radiologists for thrombectomy, ED physicians, neurosurgeons, and radiologists, intensivists in patient. Our stroke volume last year was 1871, and it is approximately 22% more than a year before in 2022. So this graph again says the same story. You know, this is the RMC, and this is Stanford, that's very far. And then somewhere here is Good Samaritan Hospital, right? So if you have to transfer patient from here to here, it's a lot of distance. But from here, it's even worse. From here, even if it's worse. And from here, if Good Sam is busy, they're not accepting new patients, they are full, you have to go all the way up to here. Now, what will happen on August 12th? There will be no neurosurgeon or neuro IR radiologist on call. So we'll have no thrombectomies, means removal of the clot from the brain. We won't be able to deal with brain bleeds, aneurysm management, complex stroke, and neurology patients like brain tumor, spinal cord tumor, spinal cord compression, cervical or lumbar radiculopathy due to non-availability of neurosurgeons and neuro IR physicians. Same situation, you will have EMS taking patients to other hospital, but the walk-ins will still come in. And if you take the daily impact, about 5 patients need to be transferred by ED or EMS to other hospitals. And this will increase disability and may cause some deaths. As we know, time is brain in stroke, and untreated patient during acute stroke can lose up to 1.9 million neurons every minute. So let's talk about STEMI program. That's the third program they're going to close. We have 20 years experience cardiac program team, including on-call STEMI cardiologist, cath lab personnel, cardiothoracic surgeon, and vascular surgeon and ED physician. Now, STEMI program stands for ST elevation myocardial infarction. It's the most severe form of heart attack and highest risk for complications and death. When we activate the code heart attack, it makes us to do cardiac catheterization lab and perform a percutaneous coronary intervention within 90 minutes of first medical contact by EMS or ED staff. Now, our stroke heart attack volume last year was STEMI about 600 per year, unstable angina 2,000 patients per year. So again, you have to transfer patient who from here regional. The nearest would be either this Kaiser, San Jose, or O'Connor, Santa Clara Valley Medical Center. And if they are busy, then you have to go farther, and farther, right? All those hospitals. So what will happen on August 12th? There'll be no cardiologist on call for heart attack. There'll be no cardiothoracic surgeon on call and no cardiac catheterization and intervention available. And if you look at the daily impact, approximately 9 patients need to be transferred by ED/EMS to other hospitals, increasing disability and death due to time sensitivity. Now, for STEMI patients, there's a saying, time equals muscle. And the reason is, if any patient with STEMI present to hospital which does not do the procedure, there is something term called door in and door out. And if your door in, door out is less than 30 minutes or less, you have better outcome than more than 30 minutes. So mortality increases by almost 2 times if door in and door out is more than 30 minutes, and it's exponential. Now, it is very hard for any hospital to meet 30 minutes deadline. It is extremely hard. So in summary, I can summarize that RMC is already without pediatrics, obstetrics, gynecology, gastroenterology, and nephrology. Medical care without these 3 additional services available to the patient walking through the doors will become substandard and at times unsafe. The confidence of physicians and staff at RMC is very low at present. Majority of the emergency department doctors are locums, and locums are the physicians who work as needed. They are not community physicians. More than that, the transfers will affect all 8 hospitals, especially the Valley Medical Center, O'Connor, Good Samaritan, Stanford, and probably Washington Hospital. If people of East San Jose, they lose confidence in RMC ability to provide standard and safe medical care, they may preferentially go to neighboring hospital for hospital level care. And it will cause overcrowding and may impact quality of medical services on other 8 hospitals in Santa Clara County and Washington Hospital in Fremont, making it truly public health tsunami induced by very irresponsible, unethical, irrational, and shameful act of HCA, where profits over people is being practiced fearlessly on open to the highly educated society of Bay Area. Just adding emergency room beds would not help. You need highly skilled doctors and staff to provide appropriate care to very sick and vulnerable population. So these specialty programs are time-sensitive medical emergencies, golden first hour in management of trauma, heart attack, and stroke may be lost or cut short for both walk-ins and EMS transported patients, increasing chances of bad outcomes, including death and disability. We are talking about dozens of lives will be affected daily by this action alone. So we request Honorable Dr. Tomas Aragon, we have been told you have authority to make a change. So please make a decision now. Please respect people of Santa Clara County who have sent you a request not to close these 3 programs. The physicians, nurses, staff are leaving already due to uncertainty of job and future of this hospital. If majority of the physicians, nurses, and staff has left hospital, and you make a decision probably next 2 months, the hospital will not be salvageable. I can tell you from doctor to doctor, a stitch in time will save 9. So this is a time to stitch it, the bleeding in the RMC. We also request the public, if you or your family or friend live or work in the Santa Clara County or Fremont or hospital catchment area of Washington Hospital, we humbly request you to sign this petition to stop the closure of specialty programs. You can do it here or you scan it. And all organizations are individuals who really care about public health, want good outcomes. Please join us to disseminate. This is our website. We have made an association to save East San Jose health system. Almost 43 physicians from the community, they are participating, including majority of the MEC at regional, as well as 4 past presidents of medical staff and host of very prominent physicians in the community. Again, I would strongly urge people to go to the website. Please read impact study released by the county, and also watch county supervisors meeting video, which will give you a lot of information, what is happening below the surface. And thank you so much for all your support. Let's work together as a community for health for all. Thank you.